So you've seen your specialist for maybe a headache, a breathlessness, chest pains, a sore throat, but you still know better. Now it may seem like a stretch, but could it all have stemmed from your gut? So you've got all sorts of different symptoms, and perhaps you've seen a different specialty for a different complaint, chest pain, a cardiologist, a headache, a neurologist, trouble breathing, you've seen a respiratory doctor, but you're not fully better. Why? Well, could the cause be your gut? Number one, chest pain. If you have it, of course, always think of your heart and make sure that it's checked. See a cardiologist. But what if it's no better after seeing a cardiologist? Could it be due to your gut? Reflux disease, or otherwise known as heartburn, is basically as it is, heartburn. It's burning over here. Chest pain, people often get a description of heaviness in the chest, palpitations, pain in the chest. Now this could be very well be gastritis or reflux disease. Now of course, if you know better on the cardiac medicines and you've had all sorts of investigations and your symptoms still persist, maybe you should see a gastroenterologist. Number two, a sore throat, a cough, sinusitis. You probably saw an ENT doctor, ENT specialist, and had all the tests, and what if they didn't find anything? So what's the cause of your symptoms? This could be very well caused by reflux disease, or more specifically, laryngopharyngeal reflux, or watch the video we did before on super reflux. Basically, it is reflux disease that's come all the way up there that's irritating the back of your throat and causing a cough and sometimes breathlessness, a sore throat, and even a change in voice. Now, is it a cause of sinusitis? No, but people often confuse sinusitis for reflux and reflux for sinusitis. So it may be the other one. Number three, asthma. Now, people have asthma, always worry about the lungs, they see a respiratory doctor, and true enough, that is the right person you should see about your lungs. But what if it's no better? Again, have you thought about your gut? Now, the reason I say this is because reflux disease can make asthma worse, and asthma can make reflux worse. So it's a vicious cycle. How does this happen? Well, if you have a wheeze, you cough, and so on and so forth, what do? You increase the abdominal pressure. Your stomach is essentially a bag, and you increase the pressure, it puts pressure on the stomach, you get reflux disease, your reflux gets worse. Anything that goes all the way up irritates the larynx, which can cause laryngitis and can irritate the bronchi, setting off an asthmatic attack. Number four, headaches. There is growing evidence to say that even constipation can be a cause of your headaches. Once you've seen the neurologist, of course, and excluded all more sinister causes, but if you have no answers, then maybe apart from constipation, consider yet again reflux disease. Reflux disease has been shown to also cause migraines or generally headaches. If you happen to have breathlessness and you know better with the respiratory physician, all the different medicines, if you keep getting asthmatic attacks and you're on optimal treatment, if you have seen the neurologist for your headache and the cardiologist for your chest pains and you are still no better, maybe it's time you see a gastroenterologist.
Da 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 da.